Most men believe prostate problems are inevitable after 50. But what if that assumption is wrong? What if an enlarged prostate is not a natural part of aging, but rather the result of overlooked daily habits and silent inflammation? The truth is, many symptoms that disrupt sleep, weaken urinary flow, and reduce quality of life are preventable. And in many cases, they can even be reversed without surgery or long-term medication. In this video, we will reveal what most doctors never tell you, the exact causes of prostate enlargement, the subtle signs you must not ignore, and the lifestyle changes that can protect and even restore prostate health. You'll learn the difference between BPH and more serious conditions like cancer, discover how your hydration habits might be making things worse, and find out which natural treatments actually work, based on science. If you're over 40 and starting to notice changes in your urinary patterns, or simply want to avoid urinary problems before they begin, this guide is for you. It's time to take control, break through the myths, and understand the real mechanisms behind prostate symptoms. You'll leave this video with clear, practical actions you can take starting today. White right pointing backhand index. If you care about your long-term health, make sure to subscribe to the channel now so you never miss essential updates on men's health and wellness. The prostate is a small, walnut-sized gland located just below the bladder and surrounding the upper part of the urethra. Though it often goes unnoticed in younger years, the prostate plays a vital role in male health, especially as one ages. Its primary function is to produce seminal fluid, which nourishes and transports sperm during ejaculation. However, because of its location, any change in size or function can significantly affect both urinary and reproductive systems. As men grow older, it is common for the prostate to enlarge, a condition known as benign prostatic hyperplasia or enlarged prostate. While this is not cancerous, it can interfere with normal urinary function by compressing the urethra, leading to noticeable symptoms. Understanding this anatomical relationship is essential for recognizing early signs of dysfunction and seeking timely care. The prostate's role extends beyond reproduction. It indirectly influences urination by maintaining the health of nearby tissues and regulating fluid flow. When the prostate enlarges, this delicate balance is disrupted, leading to urinary problems in men that can severely impact daily life. These changes may start gradually, but they often become more prominent over time. Recognizing the importance of prostate health empowers men to make informed decisions. By learning how this small gland operates and how it affects bodily functions, one becomes better equipped to avoid prostate problems before they escalate. This awareness becomes especially crucial when considering the natural hormonal shifts that occur with age. One of the main reasons the prostate enlarges with age is hormonal fluctuation, particularly involving testosterone and its derivative, dihydrotestosterone, DHT. As testosterone levels gradually decline, the body converts more of it into DHT, which has a stronger effect on prostate tissue. Over time, this hormone stimulates the growth of prostate cells, causing the gland to enlarge, a condition medically known as benign prostatic hyperplasia. This enlargement is not just about hormones, though. Chronic inflammation also plays a key role. The prostate may become irritated due to infections, stress, or even dietary triggers. When inflammation becomes persistent, it creates an environment that promotes tissue swelling and cellular overactivity. This low-grade, ongoing inflammation often goes unnoticed but gradually contributes to the enlargement process. Cellular proliferation, or the unchecked growth of cells, is another mechanism behind this condition. As the body ages, its ability to regulate cell turnover weakens. This results in an accumulation of cells in the prostate, particularly in the transition zone that surrounds the urethra. The narrowing of the urethra then disrupts normal urine flow, leading to the classic urinary symptoms associated with an enlarged prostate. Understanding these biological drivers is essential for both prevention and treatment. It highlights the importance of hormonal balance and inflammation control in maintaining prostate health. By addressing these root causes, men can take proactive steps to slow down or even reverse the enlargement process. That awareness becomes especially valuable when considering habits that can unknowingly accelerate the condition. One commonly overlooked habit that contributes to prostate enlargement is chronic dehydration. Many men over 40 reduce their water intake, either unintentionally or to avoid frequent trips to the restroom. However, inadequate hydration thickens the urine and irritates the bladder lining, which can lead to low-grade inflammation. This, in turn, may stimulate the prostate to grow as a protective response to ongoing irritation. Closely related is the habit of delaying urination. Holding urine for extended periods increases bladder pressure, which puts additional strain on the prostate. Over time, this habit can irritate the lower urinary tract, triggering inflammatory processes that may exacerbate benign prostatic hyperplasia. The discomfort might seem minor at first, but the cumulative effect on the prostate can be significant. Bladder retention also impacts nerve signaling. When the bladder becomes overstretched regularly, it may stop sending clear signals to the brain about when to empty. This creates a cycle where incomplete voiding becomes common, allowing urine to stagnate, another irritant to both the bladder and prostate. What starts as a small behavioral pattern can gradually evolve into a structural problem. To maintain proper prostate health, regular urination and consistent hydration are essential. These simple habits help flush out toxins, reduce inflammation, and prevent the conditions that contribute to an enlarged prostate. Most importantly, they are entirely within one's control, requiring only awareness and small changes in daily routine. And recognizing those early urinary patterns is the key to intercepting the next set of symptoms. The most common signs of an enlarged prostate are known as lower urinary tract symptoms, LUTS. These include frequent urination, especially at night, a weak urine stream, difficulty starting urination, and a sensation of incomplete emptying. While these symptoms may begin subtly, they often progress, becoming more disruptive to daily activities and sleep. Recognizing these signs early allows for more effective management. Men often assume these changes are a normal part of aging, but they are not to be ignored. Benign prostatic hyperplasia, BPH, can significantly impact quality of life if left untreated. The prostate grows inward and compresses the urethra, making it harder for urine to pass freely. Over time, this can cause bladder irritation, residual urine buildup, and even urinary tract infections. It is crucial to differentiate BPH from prostate cancer, as their symptoms can overlap. While BPH affects urine flow and bladder function, prostate cancer may not show noticeable signs in its early stages. However, if symptoms include blood in the urine or semen, unexplained pain, or sudden weight loss, a more thorough evaluation is essential. Diagnostic tools like the PSA test and digital rectal exam help distinguish between the two. Understanding the symptom pattern is a powerful tool in protecting prostate health. While BPH is non-cancerous, it still demands attention. Addressing urinary problems in men early prevents complications and paves the way for proper care. And when these signs appear, the next logical question becomes, what can you control to reduce the risk? While aging is inevitable, many contributing factors to prostate enlargement are within one's control. Diet plays a pivotal role. Diets high in saturated fats, red meat, and processed foods are linked to increased inflammation, which may accelerate benign prostatic hyperplasia, BPH. In contrast, a diet rich in vegetables, fruits, healthy fats, and antioxidants supports overall prostate health and reduces the risk of enlargement. Obesity is another key factor. Excess weight, particularly around the abdomen, is associated with hormonal imbalances and increased systemic inflammation. These conditions create an environment conducive to prostate growth. Additionally, abdominal fat may physically compress the bladder, worsening urinary symptoms and making the impact of an enlarged prostate even more noticeable. A sedentary lifestyle compounds these risks. Regular physical activity not only helps regulate hormone levels but also improves circulation and reduces inflammatory markers in the body. Men who exercise consistently tend to have fewer urinary complaints and a lower incidence of prostate-related problems. Incorporating even moderate movement daily can make a measurable difference over time. Caffeine, alcohol, and processed foods act as irritants to the bladder and prostate. These substances can increase urinary frequency, urgency, and discomfort, particularly when consumed in excess. By moderating their intake and focusing on a balanced, anti-inflammatory diet, men can take meaningful steps to avoid prostate problems and maintain control over their health. The next step is translating this into daily habits. Simple, consistent daily habits can have a significant impact on reducing or slowing the progression of prostate enlargement. One of the most effective strategies is proper hydration. Drinking adequate water throughout the day, without overloading the bladder at night, helps flush irritants and supports healthy urinary function. Staying hydrated also prevents urine concentration, which can otherwise inflame the bladder and prostate. Bladder training is another practical tool. This involves gradually increasing the interval between bathroom visits to strengthen bladder control. Timed voiding and relaxation techniques can help retrain the body's response, reducing urgency and improving overall urinary patterns. Such methods are particularly useful in managing lower urinary tract symptoms associated with benign prostatic hyperplasia, BPH. Dietary choices make a difference as well. Foods rich in antioxidants, such as tomatoes, lycopene, cruciferous vegetables, and fatty fish, help combat inflammation and support prostate health. Adding pumpkin seeds, green tea, and foods high in zinc may also provide protective benefits. Minimizing processed foods and reducing intake of irritants like caffeine further complements these efforts. Natural supplements can be beneficial when used responsibly. Saw palmetto, pygeum, and beta-sitosterol are among the most studied plant-based remedies for BPH. They may help reduce inflammation, regulate hormone activity, and alleviate urinary symptoms. Incorporating these habits into a daily routine offers men a proactive approach to maintaining prostate function. And when symptoms persist despite lifestyle changes, it's time to ask a critical question. Knowing when to consult a urologist is crucial for protecting long-term prostate health. While mild symptoms may be managed at home, certain warning signs require professional evaluation. These include increased urinary frequency, difficulty starting urination, a weak stream, or the sensation of incomplete bladder emptying, especially if they worsen over time. Persistent discomfort or a sudden change in urinary habits should not be ignored. One important threshold is the level at which symptoms begin interfering with quality of life. If nighttime urination disrupts sleep consistently or if daily routines are affected, it's time to seek medical guidance. A urologist can assess whether the symptoms stem from benign prostatic hyperplasia, BPH, or something more serious, such as prostate cancer. Diagnostic tools play a key role in this process. The PSA test measures prostate-specific antigen levels in the blood and may indicate inflammation, enlargement, or malignancy. A digital rectal exam, DRE, allows the physician to assess the size, shape, and texture of the prostate manually. Depending on the findings, imaging techniques such as ultrasound or MRI may be recommended to gain a more detailed view. Early detection is the cornerstone of effective treatment. Seeing a urologist before symptoms escalate helps men avoid complications and begin appropriate care. Whether the concern is mild or more serious, timely consultation can provide clarity, peace of mind, and a clear path forward. And once a diagnosis is made, the focus shifts to choosing the best treatment option. When lifestyle changes are not enough, a range of medical treatments is available to manage benign prostatic hyperplasia, BPH. One common option is the use of alpha blockers, which relax the muscles around the prostate and bladder neck, making it easier to urinate. These medications provide quick relief from symptoms, although they do not reduce the size of the prostate. For long-term control, 5-alpha reductase inhibitors are often prescribed. These drugs lower levels of dihydrotestosterone, DHT, the hormone responsible for prostate growth. Over several months, they can help shrink the prostate and slow disease progression. In some cases, a combination of alpha blockers and hormone inhibitors is used for a more comprehensive approach to managing an enlarged prostate. Many men also turn to natural supplements, either alone or in conjunction with conventional therapies. Saw palmetto, lycopene, pygeum, and beta-sitosterol are among the most researched options. While results may vary, these substances may help reduce inflammation, balance hormones, and ease urinary symptoms. It is essential to consult a healthcare provider before starting any supplement, as interactions with other medications can occur. In more advanced cases, when symptoms are severe or complications develop, surgical or minimally invasive procedures may be necessary. Options include transurethral resection of the prostate, TURP, laser therapy, and newer techniques like UroLift. These treatments aim to remove or reduce excess prostate tissue, relieving pressure on the urethra. Choosing the right intervention depends on individual factors, symptom severity, and overall health. Bullseye to go even deeper and access exclusive content, early insights, and expert Q&A sessions. Join our channel's members club today. It's where real transformation begins, beyond the basics. Ignoring prostate symptoms may seem harmless at first, but over time, that silence can lead to complications you could have prevented. The choices you make today, what you eat, how you hydrate, when you act, determine the quality of your health tomorrow. Prostate issues don't wait, and neither should you. If something you heard today resonated with you, don't just watch, take action. Start applying the daily habits, ask your doctor about the right screenings, and share this video with other men who need this knowledge but never hear it discussed. And before you go, tap that like button, leave a comment below about your biggest takeaway, and subscribe if you haven't already. Let's spread real health awareness, because silence is not strength and prevention is power.